Chemotherapy. It deals with the treatment of diseases caused by microorganisms by killing the microorganisms using chemical substances. They include antibacterial, commonly known as antibiotics, antifungal, antiviral, and antiparasitic. Antimicrobial drugs are classified based on type of action into bactericidal and bacteriostatic. Based on spectrum, they are classified as narrow spectrum and broad spectrum. Based on mechanism of action, they are classified as cell wall synthesis inhibitors, plasma membrane leakage drugs, which causes breakdown of plasma membrane, protein synthesis inhibitors, DNA synthesis inhibitors, metabolism inhibitors, which are antimetabolites. Now let's see cell wall synthesis inhibitors. Cell wall synthesis inhibitors include beta-lactams, vancomycin, cycloserine, and bacitracin. Beta-lactams are the drugs which have beta-lactam group in their compound. They include penicillins, cephalosporins, carbapenems, and monobactams. Penicillins. They are natural penicillin and semisynthetic penicillins. Natural penicillins include penicillin G. Semisynthetic are further classified as acid-resistant alternative to penicillin G, which is penicillin V, penicillinase-resistant penicillins, methicillin, cloxacillin, and dicloxacillin, extended spectrum penicillins, which include aminopenicillins, carboxypenicillins, and uridopenicillins. Cephalosporins. They are classified into 5 generations based on their spectrum of action. That is, first generation, which includes cefazolin, cefalexin, cefadroxil, cephalothene, and cephradine. They commonly have Fa in the middle of the compound. Second generation, cefoxitin, cefoprozil, cefotitan, cefametasol, and cefuroxime, cefuroxide methyl, cefalcor. Third generation include cefixime, ceftazidime, cefotaxime, ceftizoxime, cefpodoxime, ceftriaxone, and moxalactam. They have ime commonly in the end. Next, fourth generation includes cefepime and cefepirol. They have cefi in the starting. And fifth generation include ceftibiprole, ceftaroline. They have ceft in the starting. Carbapenems include imipenem, meropenem, ertapenem, and doripenem, ferropenem. Imipenem is the prototype drug. Monobactams include azithrionum. Drugs that cause plasma membrane leakage, that are amphotericin B, nystatin, polymyxin. Drugs that inhibit bacterial growth by acting as protein synthesis inhibitors. They act by inhibiting 30S subunit and act by inhibiting 50S subunit. Inhibiting 30S subunit include aminoglycosides, tetracyclines, and glycyl cyclines. Inhibiting 50S subunits include macrolides, ketolides, lincosamide, streptogramins, oxazolidines, and amphinocols. Aminoglycosides include streptomycin, gentamicin, neomycin, vancomycin, amikacin, tobramycin, panomycin, nifilmycin. They have mycin in their end. Tetracyclines. They are grouped into 3 groups. Group 1 include tetracycline, oxytetracycline, demicyclocycline. Group 2 include doxycycline and minocycline. Group 3 include tigecycline. Macrolides include erythromycin, azithromycin, roxithromycin, clarithromycin. Ketolides are the derivatives of macrolides. They include telithromycin. Generally, macrolides and ketolides have thromycin in their end. DNA synthesis inhibitors. They inhibit viral DNA synthesis in viruses. They are acyclovir, ganiclovir, zidovudine. Affect DNA function, that are rifampin and rifabutin. Used in treatment of TB. Inhibit DNA gyrase, that is fluoroquinolones. Gyrase helps in removal of supercoils formed. Fluoroquinolones include first generation and second generation. First generation are norfloxacin, ciprofloxacin, pefloxacin, ofloxacin. Second generation include levofloxacin, gemifloxacin, moxifloxacin, prulifloxacin. They have floxacin in their end. Drugs affecting metabolism, that are antimetabolites. They act by inhibiting nucleic acid synthesis indirectly. They are sulfonamides, diapsone, trimethorphan, pyrimethamine. Sulfonamides include the folic acid synthesis inhibitors. Classification of sulfonamides. systemic, local, both systemic and local. Systemic include short acting, intermediate acting, and long acting. Short acting are sulfadiazine, intermediate acting are sulfamethoxylate, long acting are sulfadoxine. Local are sulfacetamide, silver sulfadiazine, methiniol. Both systemic and local include sulfasalazine.